This is Ken Crandall, and I am calling the meeting to order, the meeting of the Seneca Healthcare District Board at 3:03. I'll do roll call for the board members. Dr. Walls,
I'm present.
Jerry Nielsen,
Present.
Kristen Montgomery,
Present.
and Rich Rydell. Not hearing Rich yet. Perhaps he'll join us. And I am Ken Crandall, and obviously I'm present. So that said, it's time for the Pledge of Allegiance. And for that, I unfortunately have to remain seated. We'll jump in right now. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. That takes us to item number 3 on our agenda, the public comment period. So TK, now would be the time if people want to make a comment for the board to do so.
And for those that are joining us, to unmute your phone, that would be *6.
Is there any public comment? Well, hearing none, I will move on. And let's just take a minute to get through the approval of the previous minutes from our April 15th meeting and April 22nd meetings. Whoops, I'm sorry, July 30th, August 15th, and August 22nd meetings. If you've had a chance to look at those and have any suggested changes, please speak up now.
No.
No? Okay.
I'll move to approve them, Ken.
All 3? Okay.
Yes.
Can I have a second?
I'll second.
Okay, Dr. Walls?
Do we lose Dr. Walls?
Oh, I said I would second it.
Well, and we had a second from Kristen, so I was asking you for your vote, Dr. Walls.
In favor.
Okay, thank you. Jerry?
Aye.
And Kristen?
Aye.
And I will vote aye as well. With that, what I'd like to do is move into our closed session. I regret doing so so early in the meeting for staff and others who may be waiting, but we have some important discussions to be made with legal counsel. And so, Chris, I'm sorry, but TK, if you can move us in that direction, but somehow keep an eye out for Rich Rydell if he joins us, to get him into the closed session.
Very good. If you could give me just a couple moments before you begin to speak. There's 28 participants, so it'll take just a minute to move everybody into the waiting room.
Very good. Thank you. So I guess we would anticipate that TK would just let us know and interrupt us real quickly in the closed session to say that Rich has joined us. Not quite sure how we facilitate that.
Well, Rich should be able to tell us when he joins.
Yeah, but TK is going to have to let him in, because we're going to be, I think. Or maybe not. Maybe he just joins and others are in the waiting room.
You'll have to ask her. I would imagine that she could see his name pop up in the waiting room, and then she could move him over without having to join our call, but we'll have to ask her.
That's my question. Okay. Dr. Walls, if I saw your mouth moving, I thought, I don't know if you're talking to us or someone else, but I know you're muted right now.
I'm talking to myself. I've been doing a lot of that lately.
All right.
Allison, can I just confirm which number you're using for audio?
I'm using my computer.
Okay, thank you. Hi, Ken, this is TK. I have you. I have Steve Boline here in the LAC conference room, Allison, Dr. Walls, Jerry, Kristen. I do not see Rich as of yet. When you guys go into closed session, I completely leave the audio and the video. So if Rich would be able to text me, then I could come back into the meeting area and then allow him into the waiting room, or I can make you the co-host and you can let him in when you see his name appear.
Okay, I'm just not, and that's the only thing that would change for me being co-host is I would see his name and I'm not sure where I go to open it up for him.
Okay, do you want to just text me once he arrives and I'll pop in at that moment and get him into the meeting area for you?
Sure. Jerry, you said you have a number from,
I have TKs. I don't have Rich's, but I have TKs.
yeah, well, if he, so we would be able to tell if he's trying to get in, TK?
I can make you the co-host, and what you'll see is the participant area. You
Okay.
see that there's 7 participating and there's 23 in the waiting area. Either his name or his phone number would appear in the waiting room.
Got it. Okay, I'm good with that.
Oh, here he comes.
Here he
Hang on
comes.
one moment, I'll bring him in right now.
All right. Okay, let the minutes reflect that Rich Rydell has joined the meeting. So all board members are present. And TK, with that said, have you exited the room?
I'm gonna leave right now. I'm gonna pause recording and then I'll be leaving here. I'll be leaving you with Steve.
Okay.
Okay, here we go.
Okay, thank you. Okay, the board has concluded its closed section and we are now entering back into open session. There was no reportable action taken during the closed session, so we'll move forward with our item number 6 on our regular agenda, open session agenda. That's the med staff report. Dr. Cooper.
Yes, it is Dr. Cooper here. We have a few issues on med staff, but I think a lot of these are kind of being put on hold until the new CEO gets on board.
Okay. I see that we have some things to be approved here. Credential files.
Yeah, there may be some.
Listed
Yeah.
on the board.
Yeah, I don't have those credentialing files before me.
Okay, that's
Okay,
fine.
I see
have
still a psychiatrist. Yeah, so we have no problem there for the initial or reappointment staff.
Correct. And I showed 2 initial appointments and 2 reappointments, correct?
That's correct.
Okay, and the reappointments are Samir Mohammed, telepsychiatry, and Johann Stan Borenstein. And then for the reappointments, we have William Zinn and James Souls. Okay,
That's correct.
thank you. Can I get a motion from a board member, unless there's any questions about these appointments?
So moved.
Okay. Can I get a second?
Second that.
Okay. Rich Rydell, how do you vote?
Aye.
Okay. Jerry,
Aye.
Kristen,
Aye.
Dr. Walls,
Aye.
and I'll vote aye. Thank you. That takes us to item number 7, policies and procedures. And I'm noting on the agenda that we have 26 policies and procedures listed. Has there been an opportunity to review, or is anyone needs to speak to this? Questions?
I just have a point to make, Ken. I think there might have been an error on the agenda because one of these, I think number 25 on here, the adverse drug reaction, I believe we're rescinding that one.
Well, there goes my dog. Is someone can, on med staff, speak to that for us?
This is Sadie.
Go
I
ahead.
have Chelsea here with me.
Okay,
The RT001 Adverse Drug Reaction and Reporting Program is being rescinded.
rescinded.
Yes.
Okay, so should we strike, I'm going to strike this one from the vote to approve, and then we have a separate vote for it?
I agree.
Okay, all right. Okay, so all of the policies listed here, 1 through 20, it'll be 25 in this case. We are, boy, this is difficult. Let's approve policies 1 through first 25 policies, 24 policies, and then we'll skip number 25, if this is clear, and also approve number 26. First, we'll have a vote, please, to look for a motion to rescind the adverse drug reaction and reporting program.
So moved.
And second,
Second.
Rich, Jerry, Rich, Dr. Walls,
Aye.
okay. Kristen? Kristen, are you there?
Mute.
Perhaps you're on mute, Kristen? Okay. Jerry, your vote?
Aye.
I don't mean to interrupt, but I can't hear you guys, so I'm going to go out and try to come back in. So I'm going to have to leave and try to come back in. For some reason, my audio's out again for hearing you guys. So
Okay.
I'll be back in just a sec.
So Dr. Walls has voted aye. Rich has voted aye. Jerry?
Aye.
Okay, and I'll vote aye, so that motion will carry. And then items 1 through 24 and also the bladder irrigation continuous policy, I need a vote to approve those.
So moved.
Jerry moves. Who will second?
Second.
I'll second.
Dr. Walls second. Rich, how do you vote?
Aye.
Okay. Kristen, are you back with us? Nope. Jerry?
Aye.
Rich?
Aye.
Okay, and I will vote aye, so that motion carries. Okay, folks, sorry, I had just a little distraction there. It takes us to item number 8, the financial report for July 2020. So that brings us up to Steve. Kristen, if you've rejoined us, please let us know when you have.
Okay, can you hear me, Ken?
I can't hear you.
Okay, very good. All right, so what we're looking at this month is the month of July 2020. It's the first month of our fiscal year. There were a couple challenges in getting a financial report to you guys, one of which is continuing to record the CARES Act funding, and then the second was come up with a budget for the fiscal year. I've come up with a tentative budget, as I call it, that is included under the administrator report. But I've also reflected it here for the month of July. So we really projected mainly off of where we're at right now, where we're at June of 2020 and going forward. And based upon all of that, we did report net income of $333,000 versus a budgeted income of $199,000. It's a positive variance of $134,000. We did have a positive variance in gross patient revenue based upon the way that we had projected out. We thought our numbers would be a little smaller. We've seen nice improvement into July, and we've also seen that same trend go into August. So we did have positive variance in gross patient revenue. We did see some negative variance in the third-party adjustments where our net patient revenue percent was 53% versus 56.9. We're going to look at that a little more. And also the bottom line positive variance, we brought in $89,000 CARES Act funding. And what we've done with this is we basically said lost net patient revenue is what the CARES Act funding was for. And so we've been trying to bring it in by doing our best to determine how much net revenue patient we lost due to COVID by comparing the current year month to the prior year month. And in doing this for July, we only came up with $89,000, but also did not budget for that. So that led to our positive variance of $134,000. We had inpatient days consistent with what we've been seeing. We did have some swing bed days. We budgeted for none just because we're not actively seeking swing bed patients. We did have one patient that was in the nursing home was at 11.52 residents, went from 12 to 11 during the month. This is about where we think we'll be. If we can find a good candidate for placement, we will, but don't believe we'll go beyond 12 until we're able to put residents into the acute wing where some of their beds are located. The outpatient revenue was up in June, mainly in the emergency department, clinic, and physical therapy. Positive budget, but still lower than July of 2019. The clinic visits were up, but just slightly below what we had budgeted. Expenses were in line. Salaries were a little bit under budget. FTEs were slightly under budget. Contract labor was a little bit over budget, and their FTEs were correspondingly so. We didn't have any supplemental money come in during the month or any additional money, so our days of cash went down based upon the loss we had for the month. And the reason I say loss is that we recognized about $530,000 of the PPP loan money, but we received the entire PPP loan back in May of 2020, so the cash is in the bank. So that income we reflect, just as we reflect the CARES Act income, does not provide cash. So on a cash basis, we have a loss for the month. The accounts receivable were up a little bit, but so was our revenue. The gross dollars were up. The days were down as our average daily revenue has gone up. And we're still quite a bit above the best practices target for AR days. I think that's it on finances. Any questions, comments, concerns?
No. Ken, I'm back. I can hear you guys now. You're muted.
Sorry, I was muted. Thank you, Kristen.
Mm-hmm.
Any questions from the board for Steve? financial report? Okay, can I have a motion to approve the report?
I move to accept the report.
Okay,
I'll second.
okay. Dr. Walls, how do you vote?
Aye.
Okay. Um, Jerry? Oh,
Aye.
No. Okay. Kristen?
Aye.
Okay. I vote aye. And who did I miss?
Aye.
Dr. Walls.
Dr. Walls. Thank you, Dr. Walls. Okay, so that motion carries. Now we'll move into item number 9 on our agenda. These are for informational purposes only. Precision instrument approach at Chester Airport. Some discussion related to the need for equipment to allow precision instrument landings at Chester Airport to help with care flight out of here. So, Rich, I think you probably were really more in tune with this conversation than anyone.
Right. We had a discussion about that capability. I have since contacted Sherry Thrall to ask her if she had any knowledge about a position either taken by the Airport Commission or anyone else who might have power in this regard, or if there are any grants available and so forth. And as of right now, you know, she did respond to my initial contact, but I don't have any more information about that. And we'll follow up personally unless there are others who know more about this than I do.
Well, so from what I understand related to this is that the airport needs some equipment to allow for precision for instrument landing. Most of our emergency services, helicopters and aircraft are equipped to do precision instrument landings, but the airport is not. So the discussion is, how do we get the airport up to speed?
This
Am I
is Dr. Cooper. I was talking to one of the CEO candidates who lives here locally on our meeting on Saturday, and he was saying that there's a group of citizens here in the valley that are going to privately finance that ILS approach, and that it was not that expensive.
Well, yay. I like the idea of this, the community approving this, or paying for this. Perfect. Should we continue this on the agenda, Rich?
Yeah, I think we ought to follow up. I'm going to try and find out more information. And, you know, I heard the same comments that there was a community group, but I think we need to follow up to make sure it happens.
Okay, sounds good to me.
Can I ask a question? Rich mentioned an airport commission. Is there a formal commission that runs the airport?
You know, I'm just harking back to the days when I was on the planning commission, that there was an airport commission that was a county commission responsible for the airports. But I don't even know what their charge was, or Dave, and I don't even know if it exists today.
Okay, thank you.
All right. Moving on to item number 10, Healthcare Resource Group. Steve?
Yeah, their reports for the month of July is in the packet. They did have some improvement in their days. Still, as I mentioned before, still well above the best practices. So far in August, we've seen some good collections, but I'm still curious to see what the numbers look like when we get to the end of the month. At least it went in the right direction. So I'm just going to jump right into the contract thing. I have not pursued finalizing the contract. I know we talked about putting some poison pills in there to sign the contract and put the poison pills in there. I did look at the contract. They want a 2-year contract that really doesn't have an out. It has the penalties for their non-performance. So that's something I'm going to have to talk to them about. Is that their final position, that they have to have that 2-year commitment with no out? Our first out would be upon the renewal at the end of the second year, we could get out. So, you know, maybe we can, if we look at, if they insist on that, which I know they've said that that's what they want because the investment they're making in this new software and that they're paying for it. So we still need to talk with them about that and come to some terms on that. So hopefully we'll have a clearer picture next month. Any questions or comments?
Oh, yes. What, did you just say they want a contract where they're going to be guaranteed 2 years no matter what their performance?
Well, currently there's no out in the agreement, the proposed agreement that they have, Rich. So the only thing is that there's the punitive financial penalties in it for them. But based upon the way the contract reads now, even though they're going to get penalized, we'd have to live with their performance. So I'm going to have to discuss that with them. Maybe we back off on them paying for the software or whatever and give us an out, but I'll have to look at that more.
Well, I can't see us signing a contract that doesn't give us an out for poor performance.
I
Right.
agree.
Yeah. Okay, so Steve, we'll
Okay.
carry this over until next time. All righty. Committee updates, Strategic Planning Committee.
Yeah, the only thing there is that we're down, I think I said this, and just doing 2 jobs for 10 months finally caught up with me. But we're down to 1 word with one section or 1 word of the contract with Collins Pine. So they're basically, where they're at right now is they're saying that we must build a hospital by 2035. And we've talked to them, and they said they'd go for a related health facility, but getting changes through Collins takes a little bit of time. So that's where we're at on them with that's where we're at with them right now. It's just down to clarifying that language is what will be our absolute commitment to do with the property. Collins just wants to protect themselves, that we don't do something not for its intended purposes. They seem to be fine with talking about associated health facilities. So, you know, if it's not a hospital specific, something that would support a hospital, because I think what Collins is also saying is they want to make sure there's a hospital here in the basin. So, and that's the source of their support in this matter. So that's where we're at on that one.
Okay, thank you, Steve.
So Steve,
item two is-
I'm sorry, Ken. I just have a quick question for Steve. So, I mean, we intend to build a facility by then, but what if, right? What if for some reason we don't? Does the land revert back to Collins?
Well, they have the right to buy it back from us. But I think our intention is to invest in the healthcare infrastructure to support this community. So whether that's a brand new spanking new hospital there, or whether that's something else, we'll have to see, and that'll certainly be a discussion for the the permanent CEO.
Thank you, Steve.
Mm-hmm.
The 2035 date, though, given the fact that they might extend the seismic requirements, to 2035 or longer, should we be stuck with that date?
Yeah, I think that that gives us 15 years to determine what we're going to do. And when I say 15 years, I mean take a course of action. I don't think that the 2035 is going to be the problem. It's going to be what are we going to do? We're going to do something. And so the date isn't necessarily the challenge for us. It's what are we ultimately going to put there? And handcuffing ourselves about what we can put there is a bigger problem, I think, than the date.
I agree with that, but the date may be a problem as well.
Yeah, well, if we're going to change that, then we can look to put in there that we at least have substantial progress or we've broken ground. We can talk about that with them.
So see, that's my question here. The 2035 date that's not for completion, that's for submission of a plan?
No, that's the way that the contract reads with Collins is to have a hospital in place by 2035.
In place?
So we'll see if we can put that language more to that we have something in place, or that we're in the progress of creating that. By creating, I mean that, it's not just on paper. We've broken ground. We have approved plans. We've gone through the OSHPD process. We just haven't built. So I can look at that.
That speaks to my question. Thank you.
Yeah.
Okay. Item B, the CEO search committee. I think we covered that in closed session. So there's nothing more for discussion there. That said, item number 12, your report, Steve, as acting administrator.
Yeah, it is. It's in your materials. The timeline's there. I have updated the projection to more incorporate the budgeted numbers, and then at the end of that, I have the tentative budget in summary form. It's just so you guys can see what the numbers look like in relation to 2020, and then what we're projecting out. Worst case scenario with that budget is that our cash flow takes about a $2 million hit, and we're sitting on, what's the number? $4 million in unspent CARES Act funds. So we're still, with that budget, our cash for the year would be positive, considering the impact of the CARES Act funding. So I'm going to work on that over the next month and come back to you guys with a more nailed down budget and narrative and assumption documentation, ask for your approval. But basically, it still demonstrates that we're able to withstand the impacts of COVID-19, and we're actually starting to perform increasingly better to where we're seeing utilization of the hospital and revenue. So as long as things stay they are as far as the environment, we're good to go.
Okay.
And I appreciate the breakdown too, Steve, of where we're recognizing on the funds on a monthly basis. That was very helpful for me personally. I thank you.
Okay, you asked for it. It was a good suggestion. Thank you.
Anything else for Steve? Steve, anything else from you?
I'm done. Thanks.
Okay, good enough. Departmental issues and reports. We had reports submitted from compliance, acute emergency department, and from human resources. So any questions from board members related to any of those reports that have been submitted?
I don't have any questions, but I wanted to say I greatly appreciate these reports. The ones that we received, the detail is very nice, and it's good for us to get a good handle on what's going on. So thank you all.
Yes, thank you.
Okay, well, we have unanimous appreciation. So thank you for that. Moving on then to items for next month's agenda. I noted that we are going to carry over the instrument thing for the airport. Are there other things that we want to add to the agenda? Steve, any recommendations?
Dr. Cooper?
I'm sorry.
This is Dr. Cooper.
Yes,
I understood there was going to be an action item in regards to Teresa Nielsen on the schedule today.
there's nothing in open session related to that.
Was medical staff going to have any input or question in regard to that?
I can't discuss this in open session.
Maybe you can talk to Dr. Cooper offline, Ken.
Yeah, happy to. Did you get that, Dr. Cooper?
Yes, I did. Thank you.
Thank you. Okay. Okay, so anyone, nothing else to add to the agenda for next time? All right. We already reported on closed session. No action reported. Next meeting is September 24th at 3 p.m. Meeting adjourned.
Thank
Thank
you,
you.
everybody.
Thanks.
Bye.